Hello and welcome to Healthline 3. I'm Terri Simmons. With me today is Dr. Howell from Willis-Knighton Bossier Surgical Associates, and we're talking today about the benefits of laparoscopic surgery. If you have a question regarding laparoscopic surgery or general surgery, please call the number you'll see on the screen throughout the show. It's 318-219-4569, and keep your questions direct to surgery so we can really get the most information with Dr. Howell today and keep it on track. And so if we want to be able to hear your question too, so just make sure you're in a quiet room and make sure your TV is turned down way down low before calling. We're happy to take your calls, and Dr. Howell live as always and free of charge. Dr. Howell, thank you so much for being with us today.
Yes, ma'am, my pleasure.
So we're going to be talking first about, well, we talk about general surgery, but the benefits of laparoscopic general surgery. What is that exactly?
Laparoscopic surgery is also referred to as minimally invasive surgery, where some simple and complex operations are performed with tiny incisions as opposed to larger incisions that we used to always have to use for these operations.
And what are the benefits of that to the patient?
The benefit to the patient is less scarring, decreased pain after surgery, and generally faster recoveries.
And why would the pain be decreased? What's the reason for that?
The reason for that is the incisions. I like to use gallbladders as an example. The incisions for laparoscopic cholecystectomy these days, they're 4 very tiny incisions, less than an inch, as opposed to when I first started doing gallbladder surgery, we had to make a very large, almost a foot-long incision in the patient's upper abdomen, and they would have to stay in the hospital anywhere from 3 to 4 days after. Now we can do a laparoscopic cholecystectomy in about 20 minutes or so, and the patient can wake up and go home.
Oh my goodness, 20 minutes for the surgery and they can wake up and go home?
Yes.
They don't have to stay in the hospital
to recover?
Not. Goodness. And so once they get home, what's the recovery after that? Do they have to take it easy? What are the restrictions?
I usually sore for just a day or two. The most common side effect I notice with my patients is some nausea after the surgery, but usually stay on liquids for 24 hours, a little sore for a day or two. I unfortunately had to have mine out about 10 years ago, had it out on a Thursday, back operating on Monday.
So you had laparoscopic surgery yourself?
I did. I got my partner to do it because he knew if it didn't go well, he would take a lot of call.
Oh, there you go. Okay. So tell us a little bit about yourself. We'd like to know about you too. Tell us what you like about what you do.
I like general surgery because it's not so much dealing with chronic problems. I like things and problems that have a definite solution. If someone comes in with appendicitis, I know that appendix needs to come out. And I know once that appendix is out, that problem is solved and that patient is going to be better. That just suits my personality.
It does. That's very kind. You know it's done, you're taking it out, and you look at your patients, and it's all good.
Yes.
How long have you been practicing?
I finished my residency in 2001. I had a brief stint in my hometown of Natchitoches for about 3 years. I practiced there. And then my good friend and surgery trainee, we trained together, Dr. Michael Banda, had a fantastic opportunity at Bossier, and I came here in I think 2005 and have been in Bossier ever since.
And I understand, I saw a little bit about your very endearing, welcoming video on the website. And I love that you chose New Orleans, right? Because you didn't know a lot of people in southern Louisiana. Most people will go somewhere where they do know people, but you chose that because you didn't know a lot of people and you wanted to meet new people. Is that right?
That's right. I was really fortunate when I finished college. I got accepted to medical school here in Shreveport and New Orleans, and everybody I went to college with was going to go to Shreveport. And I just felt like I had never lived in New Orleans before. I didn't know anybody down there, and I just wanted to do something different, and that's what I did.
And you also met your wife there, is that right?
I did meet my wife there,
yeah.
Yes.
It's very lovely. So tell us a little bit about general surgery as a whole. So what does that encompass? When it's general surgery, we talk about what you do. What does that really mean, general?
Well, it means there's no definitive organ that you're always operating on. If we're going to talk about vascular surgery, those guys are operating on blood vessels most of the time. If we're going to talk about neurosurgery, they're operating on the brain or the spine. With general surgery, it encompasses a wide range of things. I do anything from appendectomies, gallbladders, hernias are my most common operations. I do resections of the colon, whether for infectious diseases or for cancer. We do some breast surgery, what we call lumps or bumps, little cysts or growths on the skin. Just about anything. I think it's easier to say what I don't do, which is
okay.
Heart, brain, and bones. Just about everything else.
You know, and I like that you said that. That is an easier way to describe it, because I think people hear general surgery, they might think you operate on everything, like from bones and heart and brain and everything, but it is a little bit more specified than we would think as far as just general surgery.
It is, and all those things that we mentioned before, bones, brain, those are all just, in fact, separate programs and separate training. Yes. And those guys are highly skilled specialists, and you know, they kind of are in their lane. I'm in mine. Exactly.
And also, we might mention you are American board certified in what you do also.
Yes, ma'am.
Yes. So tell us a little bit more about the laparoscopic surgery, or maybe like hernias. Let's talk about hernias for a little while, since you mentioned that. What is something like, we hear that it's so common, but what is a symptom? What happens when you have a hernia, and how do you know that?
Yeah, well, so a hernia is going to be a defect. I'll just stick to abdominal wall hernias because that's a much simpler subject. It's a defect in the abdominal wall that allows the intra-abdominal contents, basically your intestines and other intra-abdominal contents, to bulge through that defect. And so most commonly what the patient will notice is a bulge, and it's very common in the groin, around the umbilicus or the belly button, and anywhere on the up and down the midline of the abdominal wall. And the patient will feel a lump or bump there and be unsure what that is. And oftentimes those are hernias, and they can sometimes be painful. As general surgeons, we like to fix or recommend fixing almost any and all hernias because there are some terrible complications that can occur. Sometimes a loop of intestine can get out in a hernia and actually get pinched off and strangled, and you can have dead intestine in that hernia. And you know, you don't have to be a surgeon to know if you have dead intestine, you're not feeling too well. And in order to avoid that, we recommend fixing any and all hernias unless there's some prohibitive reason not to do so.
What would be a prohibitive reason not to do so?
Well, the patient's general health. If the patient is incredibly ill and unable to withstand surgery, sometimes we'll try to come up with some other methods to treat the symptomologies, things like hernia belts and compressive dressings.
Okay. That's interesting to know. People pay attention. And what we're looking for is really just a change. If you're if you have just a change, anything, a peculiar pain or something like that, and you feel a bump, just call your doctor immediately and just check it out and see what's going on, so something like that doesn't go on too long. Oh,
absolutely. And we're so lucky in where I work in Bossier. I strictly work at the Bossier campus, but we have a fantastic network of primary care physicians, and they're so good at identifying these things, and then they get them to us, and we can discuss it with the patient and take care of the problem.
And let's talk a little bit more about your facility. Tell us about that. It is in Bossier. It's Willis-Knighton Bossier Surgical Associates.
Yes, ma'am. Mm-hmm. And there's two of us, myself and Dr. Michael Banda. We've been together for about, I guess, 17 or so years now. And we have a good network of primary care physicians. We do all our surgeries at that facility. We don't operate anywhere else. And myself or Dr. Banda is available 24 hours a day. And we take care of each other's patients. And if there are any issues, we're happy to step up and help each other out.
And where's that located?
That is just north of 220 off of Airline Drive, 2400 Hospital Drive.
Okay. And so you talked about gallbladder surgery too. A lot of people have their gallbladders removed. So is it that we don't need a gallbladder, or the gallbladder, like, it's removed a lot, it's often, and people can go on just fine without their gallbladder? What does it do? What's the purpose of it then?
The gallbladder is a little small organ. It's attached just to the undersurface on the right side of the liver, and its job is to store bile. It actually doesn't make the bile. The bile is made by the liver, and it's stored in the gallbladder. Whenever you eat fatty foods, the gallbladder will squeeze out a few drops of bile into the intestine to help you digest those fats. So removal of the gallbladder, once that's done, the bile will just come straight from the liver, straight from the manufacturer. Just skip the middleman and go straight to the intestines from there.
Skip the middleman. Okay. Well, speaking of that, I think we have a caller. Earl, do you have a question about surgery for Dr. Howell? What would you like to talk about?
Oh, I took some COVID shot and I took all day.
I think we're having a little bit of difficulty. We can't hear him. Okay, so we'll just go on and talk more about appendicitis. How about that? Tell us about that. Tell us about how you diagnose that, or if someone waits too late and they come in and they're in pain and it hasn't ruptured. Tell us about that.
Well, you know, appendicitis has changed a lot from when I first started. It was a lot like gallbladder. We used to make an incision on the belly, get our hands in there, remove the appendix. We do those almost all laparoscopically now, unless there's a reason we cannot proceed safely laparoscopically. In addition to that, Appendicitis was always a diagnosis of examination. You would examine the patient, and if you felt like they had appendicitis, you took them to the OR and took their appendix out. Sometimes that appendix would be normal. You still took it out. But sometimes it would be normal, and they would say that it would be okay to be wrong about it 20% of the time. That is, 20% of the time, have a negative appendectomy rate was acceptable, because you never wanted to miss somebody having appendicitis. If it ruptures, that's a terrible problem. Now, the negative rate is much less than 20%, because the CT scan has become used so much and is such a good diagnostic tool. We almost always know somebody has appendicitis before we go to the operating room with them, and that's been a tremendous stride. It avoided so many unnecessary operations. And as you mentioned, the appendix, if you have appendicitis for probably about 3 or 4 days and it's not treated, it can rupture or perforate, and then you can spill pus as well as stool into the abdomen, and that's a huge problem.
So what happens? Like, what's typically if a patient does come in, they've waited too long, it ruptures? Well, I can imagine that's probably just almost unbearable pain. They know they come in.
It's tremendous pain.
Yes.
Pain is the most common presenting symptom of appendicitis, followed by sometimes nausea and vomiting. Occasionally the patients will run a low-grade fever with it. But those patients who come in perforated are usually, I always say it's not hard to figure out. They are acutely ill and in a bind.
Yes. And so if it ruptures, then you go in, of course, and remove the appendix. Is there danger in going in? What happens when you are operating on a person whose appendix has ruptured?
Well, still sometimes we're able to do it laparoscopically.
Oh.
It depends on the situation. And you would go in just like you normally would. You identify the appendix. It's a little trickier because things are quite angry in there from the perforation. But you can often get the appendix out laparoscopically. You wash the patient out really well. And then you, oftentimes if there's a perforation, I'll put a drain in because you don't want all that yucky fluid accumulating. You want to be able to suck it out of the abdominal cavity. But even then, sometimes that's not ideal. 1 in 3 patients with a perforated appendix, no matter what you do, can develop a little abscess or a pus pocket inside the abdomen despite your best treatments.
Oh, goodness. And so what is that, like the beginnings of appendicitis? Is there a place, a localized pain where you think this might be appendicitis? Or like if you start having this pain, is it a certain area that you think?
Yes, ma'am.
Okay.
There's something called the March of Symptoms, which my old surgery professor, Dr. John McDonald, bless his soul, is a good man, used to love to talk about the March of Symptoms. But most commonly, the patients start off with kind of just a generalized bellyache around the belly button. And then over a few hours' time, the pain will begin to what we call localize and go down to the patient's right lower quadrant, just above the groin on the right side. And anytime you have a patient that tells you they started hurting around their belly button and now it's in the right lower quadrant, you have to be very suspicious of appendicitis.
Very suspicious. So tell us a little bit more about, is there any, like, is it individual to the patient? Are there still surgeries that cannot be done laparoscopy? You might think you can do it with laparoscopy, but it still has to be general surgery or has to be traditional surgery?
Yes, ma'am. We call it converting to an open operation. Okay. And that has to be done sometimes, and I do that sometimes. For an example, as many gallbladders as we do, occasionally you will find one where you just cannot identify the anatomy and you cannot safely proceed. Surgery is about safety. Mm-hmm. If you don't have safety, you have nothing. Right. So if I get in there and luckily this happens very infrequently, maybe once every couple of years, and I can't identify the things I need to identify and it's unsafe to proceed, we will not hesitate. We will open that patient and do it what we say the old-fashioned way. Mm-hmm. But if that's the right thing to do, that's what you need to be doing. And that's a judgment call. The surgeon has to know their skills and capabilities and know when that's the right thing to do. And I feel like I know that.
Of course. And it's nice to know that that's just still the option, that if that traditional way to go, because it's going to give you more information, you can still do that. It's not
you can still accomplish the operation and remain safe. Right,
remain safe.
Yes.
Okay, I think we have another caller. What would you like to talk about? Surgery with Dr. Howell?
Hello.
Hi. What's your question?
Hi. Yes. I'm wondering if you or your group performs this type of surgery, which I was diagnosed with, or you could tell me how to find a surgeon that does. If I'm saying the name proper, it's Zinker diverticular, which is in the throat, like what I understand it, like a pouch, to correct that.
Yeah, Zinker's diverticulum, it is a pouch off of the esophagus, the tube that when you swallow food from your mouth, the esophagus brings it to your stomach. And occasionally there can be a small outpouching there that can be caused for a couple of different reasons. That surgery itself, that is a very specialized surgery. We do not offer that operation, but there are some gentlemen in town. I think there's some ENT, ear, nose, and throat physicians, otolaryngologists who perform that surgery, and that's where I would start. I would start talking to we have some great ENTs in our system. They can be found, you could contact the Willis-Knighton Physicians Network, and there's just a large number of those physicians who are very, very well prepared to handle that.
Okay, thank you very much. Does that answer your question?
Well, I haven't been able to locate one yet. At least I've called a couple of ENTs. Do you know one by name, or I'll try to go through the Willis-Knighton General group? But
well, I would tell you this. I would be happy if you would call my office at 746-4460. I will investigate that myself, and I will find out who is comfortable and performs the most of these surgeries in town, and I'd be happy to get you that information.
Thank you. That's quite nice. Thank you.
No problem.
That's a very nice offer, Dr. Howell, and thank you so much, Jim, for calling in. We appreciate your question. So tell us a little bit more about, you want to talk some more about the facility and everything that you're offered there?
Sure. Well, you know, the facility, as I said, it's the only place that I've practiced, and we have a great network of primary physicians who identify these problems and get them to us in a timely manner so we can help the patient. Not only that, but after we do the surgeries, we have a group of hospitalists who their job is to take care of all the patients in the hospital. And so we know after surgery, I mean, I can operate and I feel like I can identify surgery problems, but there's a whole bunch of other stuff that goes into taking care of the patients. And when it comes to medical issues, I'm just not very good at that sort of thing, but they're outstanding at it. And so we have that network of hospitalists who can help us in the post-operative period take care of these patients. We have some great critical care physicians. Our anesthesia department is outstanding. So I love where I work. I've worked all in training and only professionally when I finished my residency. I just worked in Natchitoches, but I've worked in a lot of different hospitals, and this place is great from a general surgery standpoint, in my opinion.
Well, we can tell you really care about what you do. It's so nice to see you. I could talk to you all day about this. It's really wonderful. It does really take a team nowadays, doesn't it, to take care of patients and to give the care that they really deserve and need. It
does. You know, everybody's always like, well, who's your surgeon? And that's certainly important.
Yes.
But I'm so lucky to have such a good team. The anesthesia is great. The personnel in the OR, you know, there are nurses and what we call scrub techs who work in the OR. They are outstanding. I have a lady who I hired. I was there in Bossier at my new job for 2 weeks, and I hired this lady, and she is still with me, Jackie Phelps. Hi, Jackie. She's my right hand, and she assists me in all my operations. And we have operated so much together, we just don't even have to talk. We just go in there, we know exactly what to do and what the next step is, and it's just so nice to have that.
Well, that is definitely the kind of relationship you want with the people who are taking care of you. They like working together. They like what they're doing. It's a common love for taking care of the patient. And like you said, that's what you enjoy so much. It's getting in there and fixing things and taking care of people.
I do. Surgery is a team sport, and we have a great team.
Yeah, definitely. And speaking of that, the relationship between your team is so obvious and loving and caring and educated. And I bet it seems like you really thirst for even more and more. Knowledge is key. Just keep learning, keep practicing, keep bringing in as much as you can for your patients.
Yeah, you have to. Things change so rapidly in medicine these days. You know, it used to be that the operations we were doing were the operations they were doing 70 years ago. Things change very slowly in surgery, but now it's just moving so rapidly with robotics and all that kind of stuff, and you just have to pay attention and keep up.
You do. And tell us a little bit about your philosophy. What is your philosophy as far as taking care of patients, and your philosophy about what you do?
My philosophy is, I think a lot of it hinges on communication. You know, if I go into the patient and I say, I feel like you have a retroperitoneal neoplasm that's abutting the vena cava, what does that even mean?
Right.
You know, and I grew up in Natchitoches, and I'm a pretty simple, straightforward guy. And so, you know, if you can say, hey, you got this tumor, it's behind your guts, it's right over here, and you can draw a picture. I think it's important as a surgeon that the patients understand, number one, what their problem is. Then I think it's important that they understand what are you going to do to help them. And a conversation a lot of people don't like to have, but you have to have, is what could go wrong? You know, what could happen in this surgery that would require further treatment or help? And are there any alternatives? And I think if you have a surgeon that can't communicate that to you and explain that to you, then you're not in a good spot. You need someone that can explain those things to you, take care of you, is available to speak to you, and that everybody's comfortable with what we need to do to get better.
That's right. And did you encourage that? Like the patients should feel like they can ask you anything.
They should be able to.
Yeah.
If your surgeon can't answer your questions to your satisfaction, you may need to look somewhere else. Sometimes I'll come in a room and they'll say, "I'm sorry, I have this list," and I'm like, "I'm glad you have a list. You ask me what you want to ask me. If I don't know the answer, we'll find people that can answer these questions." But I like that. I'd much rather answer things on the front end than try to answer things on the back end.
Right. And do you have some specifics what are the questions that you would encourage someone to come in and ask you? Sometimes we don't know what we don't know. We don't know what to ask. What would you encourage a patient to really ask you about?
I would encourage them to ask me, what are you planning to do? How does this operation work? Like you asked me about the gallbladder. People ask me all the time, can I live without my appendix? Can I live without my gallbladder? Ask about what any long-term or short-term after effects of the surgery are. And ask me about, the recovery. A lot of people say, well, when can I go back to work? And that it all depends. Do you have an office job? Are you a construction worker? And these are all things. I tell them all the time, you ask me whatever you want to ask me, and I'll try to answer.
That's wonderful. And it's nice to have a plan. Like if it's nice for a patient to say, I just kind of want to know the plan. How long is it? And everyone's different. But to ask, how long am I expected to take to recover from this? What can I do? Restrictions and.
Yes. Well, one of the things I like about my job too is I get to meet a lot of different people from different walks of life. And I have some patients, I try to talk to them about what's going on, what we need to do, and they'll just stop me and say, look, you're the doc, you just do your thing, I trust you. I'm like, well, okay, you sure? I'm sure. Okay, off we go. And then I have patients, they want to know every detail. And, and a lot fall in between. And so whatever patients you are, we'll do the best we can to accommodate.
Well, I can tell you definitely put your patients at ease to just talk about everything, because like I said before, I could talk about to you about this all day long. So
sure. It's
very encouraging to know that when you have your appointment, you come in and don't feel like you're taking up too much time, or you're there, you've got you right there, the source of all information, to take the time and really ask and have that conversation.
Sure, and it's no problem. And general surgery, like another thing that I like about general surgery is our problems are so mostly so defined. We're only talking about one thing. My medical colleagues who do a great job and have a difficult job, oftentimes, they're talking about several different problems and have extended office visits. And luckily for general surgery, we can see a lot of patients in a day. The office visits are a little shorter most of the time, and we can answer all those questions because oftentimes we're discussing one entity.
Mm-hmm. And that's really good. It's very focused. You're talking about that one thing.
I say that all the time. Problem focused. Problem focused.
Problem focused.
Yes.
And you're there with the solution right there. Yeah.
I try to be. Yes, ma'am.
Yeah, that's wonderful. Tell us again where you're located and your phone number in case people are watching and wanting.
Willis-Knighton Bossier, 746-4460. It's 2400 Hospital Drive. I hope I have that address right. I know where it is. It's just north of 220 on Airline Drive.
It's on the screen right there. If anyone's watching, that's exactly how to get a hold of Dr. Howell right there.
Thank you.
So is there anything that we haven't covered yet today that you'd like people to know, or anything specific you'd like to talk about general surgery or anything like that?
I think that, as you brought up before, oftentimes I have patients who will have something wrong that they just maybe don't have time to get addressed or ignore. And one of the worst parts of my job is when I see somebody that has a problem that I can't help them. Things have gone too far. Things have gotten in such a way that I'm unable to help. And what's even more frustrating to add to that is that had I been able to address this problem maybe a year or a few months ago, easily solvable. So as you mentioned before, if you feel like something's not right or whatever, let's let your primary doctors take a look or see me, whatever you need to do. But I tell my patients with gallbladder trouble, they say, my gallbladder's not that bad. I said, well, I know it's not terrible now, I understand, but I've often had this conversation where they say it's not that bad, I'm going to wait, and then they're in the ER at midnight with a pus-filled perforated gallbladder that we may not be able to get out with the scope, and we'll all look back at that clinic visit and say, why didn't we just do this when we could have had a nice short operation in day surgery? So I would just suggest, I know sometimes we're all busy and don't have time, but if something's not right, please get checked out.
That's very good advice. as soon as you see a change. Don't wait too long. Go ahead
No.
and take your, you'd much rather, I'm sure, see someone say, hey, don't worry. And I love that you use just that regular terminology. You don't have to give anything, the scientific thing we might not understand. We have a question, you can look them straight in the eye and say, here's what's going on. Glad you came in.
Yeah, I tell them all the time, you know, they'll come see me after surgery and go, I don't know if this is normal or not. I say, I would rather you come in 1,000 times for nothing than miss the one time where we need to do something.
That's another good point too. Post-op, when someone's home and they feel like something's not quite right, but they don't want to be a complainer, they don't want to call in, they want to give it time. You don't mind, right? Call initially.
No.
This feels weird. Can you help me?
Yeah, and so we have a great network for that set up where a lot of our patients have surgery for the first time, and they don't know it's a little red. Is something wrong? And they call, and Jackie, who I mentioned earlier, and I have just hired a nurse practitioner who's been great, Shannon. Hey, Shannon. They can talk to those patients, answer almost all those questions. Now, certainly if something doesn't seem right, they'll come and ask me about it. I'll call the patient personally, speak to the patient, or we'll just have them come in and let me look. You know, if they're uncomfortable, I'll just say, come on in, let's take a look at it, and we'll see what's going on. And luckily, most of the time, it's not anything bad, thank goodness.
Yeah, thank goodness.
Yes.
Yes. Have you seen a rise in any surgeries lately, like post-COVID or anything? Has there been anything
There has been
unusual?
Not unusual, but I would say certainly a rise. In 2020, they put a moratorium on our surgeries. We couldn't operate unless it was an emergency for threat of losing our license.
Goodness.
No elective operations. And boy, I thought I might want to retire at some point. That really changed my mind because I was so bored. I mean, we were just not doing anything. And so I would say we have seen a rise in all surgeries. We're extremely busy this year, and I'm thankful for that. I like to be busy. This is the longest I've sat down in quite a while. And we've seen a rise in all surgeries. I think most people, and rightfully so, were uncomfortable coming to the hospital just because of that, and I don't blame them. And a lot of things that have been kind of put to the side are now coming to the forefront, and we're getting all those addressed, trying to catch back up.
And did you see anything, like once the restrictions were lifted, did you see a lot of some serious surgeries that maybe had gone on too long that people felt they couldn't get help? And
well, no. Most of the urgent, emergent things would come in and we take care of, regardless of the
someone that might have waited
situation.
too long because they weren't sure.
A little bit of that, not terribly bad, but I think just most of the things, luckily, that weren't life-threatening problems that would get worse and worse. Just all the people that had like a little gallbladder pain and were putting it off, they're all showing back up again, which we're thankful for. We like helping people.
Yes, you do. That's very nice. I'm sure you do help a lot of people.
We try to. Yes, ma'am.
So anything else? We got a couple more minutes here you'd like to let us know before we wrap up?
I would say that, like the gentleman that called about the Zinker's diverticulum earlier, it never hurts to come by or call us and ask about if we do certain operations or some that we just do not do, or like we talked about specialists before. But certainly if you have a specific problem, we can find out who in town does such a thing or find the right people for you to talk to. So we're pretty easy to get a hold of. We've been in the same place forever, and if you need anything, please let us know.
And I love that. It's such a delightful note to end on, actually, the way you helped that gentleman and offered to take care of. You may not do it, you may not handle that, but we'll find someone who can. And
Sure.
I think that's something to remember with our medical professionals, and certainly throughout Willis-Knighton. Everyone is anxious to help you, and if you won't hear like, that's not my job, I don't do that. There's always, you're all a network, you're all helping each other, and you find ways to connect people to the person who can help you. So that's another thing. Don't be afraid, call a doctor. Don't be afraid that you're calling the wrong doctor, the wrong specialty. If you have a question, chances are just call a medical professional, right? And they can lead you the right way.
Yeah, certainly. If they don't do that, they should be at least be able to give you a trail to follow to get where you need to go.
Right.
And I know everybody in all our staff and fellow physicians in Bossier are happy to do such a thing.
Okay. Sounds really good. So that's really good. Anything else? We've covered a lot today. It's been so informative. Thank you so much.
Yeah, I'm happy to do it.
So call you if you need any help. Don't wait too long. Appendicitis, call about general surgery, and definitely back to the benefits of laparoscopy. If someone has laparoscopic surgery, it's okay.
Yes.
It's good. Very minimal recovery.
Yes, all
Small
that is
incision.
true.
All
yes.
right. Wonderful. Well, thank you so much, Dr. Howell. It's been such a pleasure meeting you. I look forward to you coming back and talking to us some more about general surgery and Willis-Knighton Bossier Surgical Associates. Thank you so much for being here.
We'll be happy to do that.
Everyone else, we'll see you next time. Take care. Have a good afternoon.